My clock has just struck 2, so I think we're pretty well due to start. We'll just give a moment or two for latecomers to come. I won't slavishly go through who's here because I think you'll be able to see that from the side bar. So very briefly then, this is a meeting of the Public Accountability Board for January 2022, and you're all very welcome. I do have a couple of apologies though from Sophie Abbott from my office, who unfortunately, Chief Finance Officer, who unfortunately is not well, so she can't be with us. And I think Jackie Bland can't be here. Lauren, I don't know whether Tim is here or not. I can't see him on my list, so he's probably sending apologies.
Tim's also sending apologies.
Okay. Are there any other notable apologies, Sally?
No, not as far as I'm aware.
Or not so notable apologies? Apologies of no sort. Okay, thanks. Well, shall we crack on? We've got a fair bit to go through. There's some fairly important items and issues, and I shall be very conscious of the time as we go forwards. So let's begin on the agenda then. And first of all, to say that we are being filmed. It will be recorded, and this meeting will be uploaded on our website if all goes well with the recording. Item 3 then, announcements. I don't think there are any announcements unless anyone wants to jump in quickly. So shall we move to 4? Item 4 is public questions, and I don't think there are any of those, Sally, unless something's come in
No.
that I know about. Okay. But item 5, urgent items, there are a couple of things. Firstly, we always have something said about coronavirus, what's been happening as far as the force are concerned, South Yorkshire Police are concerned. And Lauren, if I could ask you to do that first of all.
Yeah, good afternoon, Commissioner. So Omicron has had an impact on us in the workforce, in the workplace. We've currently got about an 8% abstraction level due to COVID. We've had 270 staff currently who've had a positive PCR test, and we've got another 184 who have had a positive lateral flow test but are still waiting for the result of the PCR. So we've got a number of people away from the workplace. It's pleasing to note that at least half of those are able to work from home. They are well enough to work from home and they've got the equipment that enables them to do that. Of the remaining half, about half of them at any one time aren't well enough to work from home, because I think even when you have a mild version of COVID, it still manages to knock you off your feet for a couple of days at a time. And we do unfortunately have some staff who just can't do their jobs from home. So, for example, you can't be a detention officer from your home address. But those staff that are able to work from home are working from home effectively. So we have had some significant pressures in some key teams, particularly leading up to Christmas. We had some outbreaks in the force control room, which caused some staffing pressures there. And we also had an outbreak in one of our firearms support group. Fortunately, none of these have impacted on our ability to carry out business as usual, and all our resilience plans have been put into place. We are asking staff at times to work additional hours. We're keeping people on or bringing them in early to help cover for some of the abstractions. And Sarah was Gold Commander at the weekend and particularly saw some of those issues across response teams at Sheffield. But I think it's positive to report that we are continuing to work effectively. Our numbers are being maintained with the support of our staff who are continuing to go and do that bit extra in order to deliver for our communities.
Well, thank you. 8% absentee rate seems extraordinarily low, given the fact that we've got the Omicron variant, which is very transmissible, causing a lot of infection. And when you hear what's happening elsewhere in the public sector, that does seem to me quite remarkable.
Yeah, very early on at the start of December, when news about Omicron started to emerge and we started to see some data predictions around it, we did revert to sort of full COVID high alert status. So we reinvigorated our messages to staff about wearing masks, social distancing, lateral flow testing. We've got one-way systems in our buildings. So we've really encouraged staff to not be complacent around COVID and to continue to take every measure that they can to sort of avoid putting themselves and others at risk.
And to see 101 is operating as well, because I think when people get in touch with me about 101 during the time of the pandemic, I don't think they realise that, yes, coronavirus can affect call handlers as well. And that is very good to hear that that's holding up.
Yeah, there have been some challenges, and there have been
Yes.
particular shifts which have been short-staffed. We've had to work around which calls are going to be prioritised. So we obviously focus on the emergency calls, and on some days I'm sure the 101 times may have crept up. But I think in all the circumstances, I think that the staff at the Force Control Room are doing a really fantastic job.
Thank you. Well, we ought to thank all members of the force, both officers and staff, I think, for managing to maintain the service in these extremely difficult times. And I just hope we can do that going forward, because, as I say, this variant clearly is affecting large numbers of people. Thank you for that. I don't know whether anybody has anything to add, or are we okay with that? Shall we move then to the second urgent item? That's around CSE. There's been a lot of speculation in the media, and indeed I've had a lot of email traffic and people getting in touch with me around child sexual exploitation, particularly around the recording of the ethnicity of suspects, for example. I know there's a motion before Rotherham Borough Council later this week. I just wondered if you could say something around CSE and those issues that have crept up in the last few days.
Okay, well, of course, as you're aware, there has been some media coverage and subsequently, quite rightly, questions from the public regarding our 2019 CSE profile. Concerns have been raised specifically in respect of the recording of the ethnicity of CSE suspects. So firstly, I'd like to comment on some concerns around the transparency of South Yorkshire Police on CSE. So profiles are prepared across a range of crime types, and these are effectively intelligence documents and are not designed for a public audience. Our 2019 CSE profile, having been prepared for policing purposes, included data and information that may identify victims and or suspects, clearly details which aren't suitable for a broad audience. A redacted version of that 2019 profile has now been published on our website, ensuring that information that was shared with the media, which has led to some of these questions coming forward, is available for the public to see themselves. Unfortunately, I don't think the format is particularly user-friendly or easy to follow. It is a redacted police document. Given the clear public interest in this area of the force's work and my commitment to openness, I've initiated a change as to how the CSE profile is written for future years. So in addition to the police document, there will now also be a public-facing CSE profile, which is published on our website. The content of this will include everything from the police document, with the exception of the sensitive information, but it will be written in an improved and more accessible format. Additionally, I've also tasked our communications teams to refresh the CSE section of our website, ensuring that that's kept up to date with our progress operationally and against recommendations. So I trust that these measures and our continued engagement with partners and the public will reassure people as to our commitment to tackling CSE and our transparency in doing that. I'd like now to specifically comment and offer some reassurance regarding the issue of the recording of the ethnicity of CSE suspects and offenders. So, as I've already stated, the 2019 profile was prepared for internal purposes only. The profile since this date have evolved, particularly in relation to the clarity of the data that's reported. And the increasing quality of profiles really is a reflection of the investment in our analytical capability over this period. The changes that have been made from 2020 onwards make direct comparisons to look at progress a little bit difficult. But I hope what I'm about to tell you gives some clarity on the extent of the issue in 2019 and some reassurance as to improvement since then. It may start to sound a bit technical, so if you need anything clarifying at any point, then please do stop me. So the 2019 profile reports separately on suspects where offences were cyber enabled and those offences where there was no online element. So using the Rotherham data, that's the one which has caused many questions to be asked. I'll just illustrate what that means. So the profile for 2019 detailed that there were 18 suspects identified for crimes without a cyber element.
Did you say 18, 1-8?
1-8, yes.
8,
1-8.
thank
you. So of those 18 suspects, their ethnicity was not recorded at the time the profile was compiled in 12 cases, which equates to that 67% of the total. From 2020 onwards, the data set for ethnicity that's used monitors compliance with the recording of the ethnicity of suspects for all CSE offences. So where a suspect's identified, whether it's online or offline, if the suspect's identified, the ethnicity should be recorded, and we look at that collectively now. So I've had that data set retrospectively applied to the 2019 time period, and that demonstrates a force non-compliance level of 49%. And in Rotherham, the non-compliance is 53%. That level of compliance is by no means acceptable, but it is better than the profile as published suggests. And the primary reason for the improvement is the records being updated after the data cut-off date for the profile, as more information becomes known and is updated on our systems about suspects. So compliance level of around 50% is clearly not acceptable. I am pleased to report that our direction of travel is positive, and improvements can be seen across 2020 when force compliance was at 60%, and into 2021 where it currently is at 62%. It's worth noting that for both of those years, Rotherham has the highest compliance rates across the force, and it's currently tracking at 72%. So the 2021 year will end in March, in line with the financial year, and the 2021 profile will be published after this time, and it will include data on compliance levels. So the unacceptable levels of compliance arise from issues of data quality. They've got some roots in IT systems, and there's also some element of human error and oversight. So temporary ACC Dan Thorpe is currently leading a piece of work across the force to drive improvements in data quality across the board, focused on the human side of these errors, whilst temporary ACC Sarah Pullman is currently leading a piece of work with one of our IT suppliers to give us really some technical improvements to assist in data quality capture and more effective process. And what I'll just say, and obviously Sarah and Dan are both in the meeting if you wish to ask them any questions or get any updates about those groups, is that these are pieces of work that are broad data quality issues across the force, and they predate this particular scrutiny around the CSE suspect ethnicity monitoring. So I don't know if at that point you'd like a comment from either Sarah or Dan on the pieces of work that they're doing.
I think that might be helpful, and particularly I'm thinking of the public listening in or reading about something called data quality, what exactly that means, and perhaps you could explain that a little bit.
Dan, do you want to pick that bit up?
Yes, certainly. Thanks, Commissioner. Yeah, so I chair a monthly meeting with people from our information compliance unit that specialises in the collection of data and how we manage that as an organisation. So it covers the whole organisation rather than individual departments. And how our whole purpose for that is to make sure that the quality that our officers and staff are inputting on the systems, the various systems that we use, that we are completing all the relevant fields wherever that is possible. And just before Christmas, actually, I pulled together a bit of a face-to-video broadcast for the force, just reiterating the importance of that and why it's important, number one, and number two, the ramifications if accurate data isn't recorded on our systems and what that can lead to. But the goal group also looks at other aspects as well. So where we are proactively searching for inaccurate data and putting that right before it causes the force an issue. So we've proactively got teams looking at inaccurate recording and then going back to the officers and the relevant members of staff and asking for that data to be re-inputted. So we've got a reactive arm, if you like, and a proactive arm to try and maximise our opportunities, really. So my role is, and the work that carries out, is just trying to make sure that our officers and staff aware of how important it is for them to spend time and accurately completing, for example, the ethnicity status on crime reports.
And the reason why they might not be, they're having to fill something in, are they, to do this? So the reason they might not be is what? Because they're just so pressurized with work, or?
It could be pressurized on work, or it could be that they've forgotten to ask, for example, a victim their self-defined ethnicity. So that may cause them to recontact the victim and ask them how they believe their ethnicity characteristic would be classified on our system. So there's a number of reasons for it, but it's, again, bearing in mind we're actively recruiting in some quite large waves of new officers, which we're very welcome. And we're looking forward to those officers embedding. On the other hand, we're conscious that these are fresh-faced officers, and it's not just fresh-faced officers and new recruits. You can have some really experienced officers that, due to things like workloads and pressures, which is, you've already heard around the impact that COVID can have on our workforce. I'm not naive to think that the pressure doesn't play a part. So I think there's a combination of factors, and what we just really need to do is keep that education going, keep the checks going, and this is why the proactive arm that I manage through that monthly meeting is really important. So we're looking for where these errors are occurring and trying to put them right before they cause us an issue.
I mean, clearly, proper recording of CS, indeed all crime, but CSE is a particularly sensitive issue for us here in South Yorkshire, but it ought to be across the country. Is what we're finding here, or perhaps you don't know the answer to that, is what we're finding here typical, or do we know anything about what's happening in the rest of the country?
I don't think that we do, Commissioner. I don't think, because it's the recording of ethnicity of suspects isn't mandatory. So actually being able to compare force against force for compliance isn't straightforward, because not all forces will necessarily be doing it.
So some might not be doing this at all.
I'd be very surprised if some weren't. But because it's not mandatory, the information isn't sort of made and shared publicly.
Yeah, okay.
So just to reassure you, Commissioner, I ran and chaired a regional meeting with the 7 North East forces this morning around victims and witnesses, and I asked exactly that question. It was predominantly around victims, but the same could be applied to suspects. So I asked, okay, what are the forces? And I referenced the media coverage that South Yorkshire had experienced over the last couple of weeks, and asked what other forces were doing, what their levels of compliance were. And I think it's fair to say that a number of them voiced similar concerns, and that aligns to what Marm Pulteney has just articulated there, that we don't have a mandate in the annual data return for the Home Office that requires us to provide this detail, which then inhibits and prevents our service providers in terms of our IT products, so our software providers. It stops them from doing the updates and mandating those fields. So and they do it so that their promise is that once it's mandated centrally, that they will ensure that their product complies. But until the point that it's mandated, they won't. So that poses a challenge to most forces, I think it's fair to say. I don't have the exact data of compliance levels, and obviously specifically around CSE, again, it's quite a niche crime type. But I don't think we will be dissimilar. But as Marm Pulteney has already articulated, lots of things have taken place since 2019 to improve that picture. And one of the reasons why I've started engaging with NEC, who's the provider of our crime recording system, is around some of these key issues that and kind of it aligns and complements the work that Dan's doing. So instead of getting the cops to retrospectively correct, what I want to do is get NEC to mandate some of these fields, so it's impossible for the police officers though, I mean, there's always an element of human fallibility, of course, so they may still get it wrong, but it means that they can't leave it out. So what you've seen around CSE ethnicity is the officers have simply clicked on unknown. And if you recall, I did quite a lot of work on hate crime around race hate crime and ethnicity in that world. And that was, I found out that predominantly it's because when the police officer looks at the field, unknown is the first box that pops up. So they just they ride over it because it's not a mandated field for them to actually go in and complete. And that's some of the work that I'm trying to work with NEC to correct, so that we make the life of the cops easier, and then there is less need for that retrospective work that Dan's just alluded to. So it's an ongoing piece of work.
Yeah, and if I remember right, the Home Secretary said quite recently that this would be required anyway by March of all police forces. Have we heard any more about that?
Shall I answer that, Mum? Okay, so we've made some inquiries with our staff who deal with all of the annual data return. No, that hasn't come through as yet. And it's interesting to note that Priti Patel mentioned that she was going to mandate ethnicity being captured on all of those suspects arrested or in custody. And we have done a vast amount of work in the last few years around custody to improve the ethnicity capture of suspects. And a recent review of custody in, I think it was 10 months up to December or 12 months up to December last year, was showing us at 97% compliance. So 3% of, only 3% of those in custody did not have their ethnicity captured. And there is a monthly view on ethnicity capture within our custody environment. So if what Priti Patel announced in response to the Times article comes to realization, we should be in a relatively strong position to, one, be able to answer the question and provide the data because we're already collating it, but two, also in terms of our compliance levels. So that work in custody has really evolved over the last 18 months, 2 years. The question still remains, and as Mark Courtney alluded to earlier, we're at kind of 40% non-compliance from 2020. So still work to be done. And most of those suspects will not be arrested at that point in time. And we have to be really cognizant that any of these profiles are a data capture at one point in time. And we know that CSE investigations are complicated. Often full suspect details are not known. So they may have a first name, or they might have a full name, but it's a false name. So there's lots of work that needs to be done to identify the true suspect. And only then can you obviously apply ethnicity when you know who you're dealing with. So there are some challenges, but we're really striving to increase our compliance levels around CSE ethnicity, both suspect and victim. So it gives us that broader understanding right across the force, excuse me, and at local level of our victimology and our suspect profile.
Thank you. That's very helpful. Lauren, I think you had more to say.
Just a few general points for further reassurance. So in relation to CSE, each district holds a regular CSE tasking meeting where all CSE intelligence and incidents are discussed, with actions set for disruption for both police and our partners. And those meetings are held fortnightly in most districts, although Rotherham hold theirs on a weekly basis. There's also a monthly force-wide meeting, which is chaired by the theme lead, DCI Rob Platts. So at that forum, intelligence, investigations, key themes and learning are discussed and disseminated to make sure that we optimise our service across the force. As a force, we're consistently using the national tracking system and associated processes to support and safeguard victims of CSE. And we've recently been praised for that in a peer review by the National County Lines Coordination Centre. We have a review ongoing of our PVP structure, which incorporates both CSE and CCE child criminal exploitation, to ensure that our structures and resourcing are fit for purpose and that things are working together well. Additionally, as you're aware, there's an ongoing independent review of the police and social care response to CSE in Rotherham. When that concludes, it's my intention to invite a number of key interested parties, including locally elected representatives from that area and members of the media, into the force to see firsthand what we are doing in order to tackle CSE. So I give this information, Commissioner, hoping that it gives you reassurance, not only as to our commitment to tackling CSE, but also to our transparency in doing that as well.
Yeah, thank you very much. I think that's very helpful, because I think there's been a lot of well, misinformation and also some lack of knowledge of exactly what's going on floating about. And I do hope that some of our local elected members, if they do want to know more, that they get in touch with us before making pronouncements in public. That's just very helpful. I'd have thought to them as well as to ourselves. Okay, thank you. Anything else under urgent items?
Not for me, thank you.
Okay, shall we move then to item 6, which is what is item 6? Items to be considered in the absence of the present public. Don't think there are any, Sally.
No, none.
And are there any declarations of interest that we don't know about, that we should know about? No. Okay. So on to item 8, which is the minutes of the meeting held on the 6th of December. That's pages 5 to 18 in the document pack. Anybody got any questions, queries, alterations they want to make about the minutes, or are we happy to accept the minutes? I think the minutes are accepted. And then we come to the actions arising from the minutes, which is item 9, and that's page 17. Just a couple of things. Michelle, do you want to just tell us what we're going to do with them?
I can quickly deal with those, Commissioner. There's 2 that relate to pilots. Both of them have been programmed for forthcoming PABs on the work programme. So can I suggest we discharge them here, because Sally's got them on the work programme? Thank you.
Yeah, that's fine. If they're on the work programme, they'll be dealt with. Everybody happy? Okay. So we come then to forced performance and item 10, the first of the substantive items. And I think I saw Shelley Helmsley from who the district commander of Sheffield on the call, and now indeed I can see her, albeit virtually. Welcome, Shelley, and it's your report. We won't go through page by page because it's quite a full report, and thank you very much for that. And it's clearly written and easy, and it's accessible to the public, and I do thank those who write the reports for that. I think they've really improved since we started doing this. But if I can take you into the report, I got 1 or 2 questions, and then as usual at the end, if there are things that you want to take up that we haven't mentioned, we can come back to them. So if I could start with page 21, and this is on 3.13, complete victim care. Well, I think it begins a little bit above that in the paragraph immediately before complete victim care. You talk about the District Investigation Management Unit, which I hadn't heard about. Well, it's relatively new, isn't it? It just seemed to be a very good thing that you have here. I wonder if you could just very briefly explain it. But also, if it is having this impact of reducing crime demand by 20 to 25%, A, why don't we just do something like this anyway? And B, is it something that's being done all across the force in all districts?
So, Commissioner, you will know that each of the districts have a number of officers that are not currently operationally able to go out and do public-facing duties. And in Sheffield, just because of the size of the district, we tend to have more of those staff that roll in or out of needing and requiring support that make up our district support hub. We were challenged over the summer by ACC Thorpe about how we could put some of our staff back into the front line to support operational delivery. And that made us re-look at our people within the district support hub and wonder how they could actually, without being able to go out operationally, because many of them weren't able to, how they could contribute to frontline operational duties. And so what they do now is that all of the crimes that are crime that come through from the public, through the Force Crime Bureau and for allocation into Sheffield, they review all of those for evidential opportunities and also to see whether or not they do need to go to an operational frontline officer or can be managed in-house. And when I say managed in-house and desktop, they have got the capability to take statements from victims. They can make arrangements to get CCTV coverage, and they can also make contact with victims to see whether or not there are lines of inquiry without having to go out and attend their addresses. And so when we talk about that reduction in demand that goes to the front line, they are crimes that are rightly and appropriately able to either be dealt with by desktop or by them dealing with victims that are willing to come into the police station to manage their inquiries. So it has been really successful for us. And it's taken some of the operational workload from our response teams, which has been really important over the summer period and over the period where we have had abstractions like on COP26. And in fact, I think this is something that probably may not be required for time, as we go along further. Because I know there's a lot of work that is ongoing within the force looking at crime management functionality, and it may mean that we don't need to do that locally at district, but certainly for the time being, they really are an excellent resource, and it is a good way to have them making their full commitment towards operational demand and public service delivery.
This is the sort of thing that retired officers could do.
Yeah, I mean, it tends to be, there's a number of older in-service officers in that team, but we also, it's been a good place for where we've had student officers that may not be operationally able for a short period because either they are injured on duty or they've had sickness and they're coming back into the work. So there's a variety of officers in there, but yes, certainly older officers would be able to do that role very competently.
Okay, just continuing that complete victim care over my page, top of page 22, it talks about the enhanced service that's available to some victims. Could you just say a word about that? Who's entitled to that?
So in terms of enhanced service, that is for children that are under the age of 18 at the time of reporting. It's for those people who are vulnerable, but vulnerable to the statutory definition of the Youth and Criminal Justice Evidence Act. And it also relates to a number of specific crime types, which tend to be the most serious crime types. So, for example, and I can read you out the list, there's arson, endangering life, there's attempt murder, domestic abuse comes within that category, and then also crime types like false imprisonment, hate crime, modern slavery, stalking and harassment, wounding, kidnap and sexual offences. So we can identify those victims either by their age or by the crime type generally that they're the victim in, which allows us at district, and again through our district support hub, to identify those crimes as they're coming in and flag them properly to ensure our officers do know they're entitled to the enhanced service, which is about how quickly they may have updates. Primarily, and whether or not they need any support as they go through the criminal justice system.
Thank you. I'm looking at the next paragraph as well, 3.14, student officers. We know that there will be an increase in the number of officers coming forward because of the uplift programs. I think the public perception is there are a large number of officers who are all fully formed, all wrapped up in high visibility jackets, in a cupboard somewhere, and you're going to open the door, they'll all fall out and they'll all be on the streets. I wonder if you could just say a word around how we manage public expectation around this, really, and then something about detectives, because I know there's a particular shortage there, and you've opened up a new route into the force, haven't you, for detectives?
Yes, so we have a cohort of Detective Now students. It's only a very small cohort. I think we've got 7, if I can remember rightly, 7 officers so far that are on that programme. but in Sheffield. But ultimately, it is similar to the Police Now entry cohort, where people come in to be dedicated towards neighbourhood policing. So they get a grounding in general policing, but they would then move into a specialism much sooner than a police officer through an ordinary entry route would do. Which is a really excellent way of boosting the numbers of officers and staff that we have in those areas of policing. But I suppose ultimately the benefit of the new entry routes into policing, both the degree apprenticeship and the degree holders entry programme, are very much more structured now, that allow officers and staff to spend much more time during their learning phase in working with detectives, investigation portfolios, and working with neighbourhood officers. So I think that it will bear fruit as we go through time and they become embedded within the district, because we'll have more staff that are aware of what those pathways look like and interested in following them. What that does give, and you're right, they don't come as a final product. It takes some hard work to get our students the experience, expertise that they need. And that comes with a lot of training, tutoring and mentoring by our officers that are already in post. But longer term, it will give those officers a really good grounding in policing. And I think we'll see certainly their experience and their expertise accelerated compared to what the older entry routes used to be. But I won't say that it isn't an easy task, because there are large numbers that need to be supported and developed, but it will be worthwhile, and we can see that happening.
And at the same time, you've got older, more experienced officers leaving because of they're retiring or whatever. Quite a big cohort of those leaving over the next few years as well. So it must be quite hard balancing these two, or getting these two aligned. But
yes, it is, but it's an opportunity as well, and I'm really heartened because many of our officers that are working with the student officers at the minute have got nothing but really great things to say about their attitudes, their motivations, their ability. So yes, it's a big job of work to get them ready and really sat within our teams delivering day in, day out. But actually, it's a really heartening process, and I think in time to come, over the next few months, we'll really see the benefits of that.
Yeah, sure. Thank you. On page 24 now, this is under the heading Protecting the Vulnerable, and it's domestic abuse. And you're talking there about rising domestic abuse crimes and domestic abuse incidents, and there are some year-on-year comparisons. I just wonder whether you could say, have we got to the point yet where we're back to pre-coronavirus levels of domestic abuse or not?
So I couldn't say with accuracy because I've not got that data in front of me now, but I mean, there are two things that could be happening here. And in truth, during coronavirus, as you know, I was the domestic abuse lead for some time. So initially, straight after the lockdown period, back in March 2020, not last year now, 2 years ago, we did see a slight reduction in domestic abuse reporting, but it has held up mostly. So we didn't, other than in those initial phases, once we got to the summer of 2020, we started to see, from my perspective, normal reporting levels. And I think there's potentially a couple of things that are happening here, that our officers are better at recognising not only when they go to a domestic abuse incident, that incident that's being reported, but also getting better at understanding the additional crimes that a victim may be describing, because they start talking about what it is like to be them in that relationship. So we might see more crimes reported in that way. But also, I think throughout coronavirus, there's been a lot of campaigns nationally and locally about please still report, because we're here, we're listening, and we want to deal with it. So I think there's probably a couple of things going on here, to be honest.
Okay. A similar kind of question, top of page 25. This is talking about arrest rates of domestic abuse perpetrators, and very glad to see that you've got those who are in the highest risk bracket. You've got 94% arrest rate there, but then it falls to an overall arrest rate of 49%, but 19% as for the standard risk offences. Now, I don't know whether you can explain how you go from standard to medium to high, but that seems very low. That was all. And I mean, good that the high risks are arrested, 94%. But is 90%, is that something we should worry about?
Well, first of all, I'm really pleased and proud that our arrest rate for high-risk domestic abuse is well above 90%, because for me that is a really important indicator. I think, and those are the victims that are most at risk. We're talking that we're really concerned about their threats to their life and ongoing safety in relationships. So from my perspective, I'm really pleased about that. And then in terms of the standard risk, I think you are always likely to see a lower arrest rate in terms of standard risk. And there's a couple of things that happen, I suppose, that are necessary to know for the public here. In terms of the domestic abuse definition, that has broadened lately as a reduce of the Domestic Abuse Powers Bill, and therefore there are lots of different relationships that are now reported as domestic abuse, and that could be a sister and brother, or two sisters that are having an argument that has been reported. So that doesn't necessarily mean that those people are partners, ex-partners, or intimate partners. There's probably a more broader span of relationships that are recognised within the standard risk, and therefore more likely it is appropriate that arrest is not always the most appropriate way of doing that. I think from my perspective, I'm comfortable with it. I would like to see it higher. I think possibly around 25% might be more reasonable. But having said that, we're doing a lot of work within the district to understand what the difference of the definition broadening has made on our domestic abuse arrest rates, to try and understand exactly whether or not we've got that right. And what I can give you some reassurance of is that there is, domestic abuse is such an important priority for the district that we have a weekly meeting led by our DCI that reviews the domestic abuse arrest rate, our outcomes, how many suspects we still have to arrest, what the appropriate course of action would be, and ensuring that we have the best possible governance around what happens in domestic abuse. So I am comfortable, and it's right that you would see that different proportionality between arrest rates for those different risk assessment levels.
Yeah, thank you. That's helpful, and it's right that the definition is broadened in the way you describe, but it may not help public perception if, when they hear the word domestic abuse, they think partners, couples in that way, and then see these figures. But when you explain it like that, then I think it makes it clearer. Okay.
Yeah, absolutely. I think if I was to talk to my mum and dad about what domestic abuse looks like, that looks like married partners, or it looks like partners, or it looks like intimate relationships, but it is a much broader definition now, and rightly so.
Yeah, okay. It's about who does the washing up where I come from, but there we are. On page 26, Shirley, this is safeguarding children, and you say there, it's the second paragraph down, you're talking about the local referral unit, and if you could say a word around that. And you've got the figure of 60 children being referred into the local referral unit. That sounds to me, I know we're in a big city here in Sheffield, that sounds to me a high number of children. I don't know whether you've got any feel for that, whether we should be worried about that or what.
So we've got really well embedded processes around the local referral unit, and the local referral unit is the police arm of the multi-agency safeguarding hub. So those staff work down in a local authority building, working directly with social care and other professionals that deal with children and children's safeguarding. Now that 60 strategy meetings aren't necessarily the only children that have been referred into the hub for a review around their circumstances. But in general, these are young people whereby our police arm, social care arm and health have a discussion and think there is value in a professionals meeting for a discussion about how an investigation might be handled going forward, who does that, and what additional safeguarding and support a child might need in the circumstances that they are living. So I've got a pretty new detective superintendent here in Sheffield. She comes from a safeguarding background and has recently been in, or a few years ago, worked within a PVP team, and I have asked her to look at our LRU, the workload in there, and if we think that there is that 60 feels right, because the staff are co-located, what they may be doing is calling that a strategy meeting when it is a professionals discussion around the best way forward. And actually by using them as a strategy meeting, we might, neither the police nor social care we might be increasing our workload when it's not necessary. So I've just had to have another look at how that looks, but I'm comfortable that there's some really well entrenched relationships and understanding and knowledge that works in that multi-agency safeguarding hub doing the right thing.
Okay, thank you.
And Commissioner, just on that note, sorry to interrupt you, but just I think in light of Arthur Lavigne-Hughes and Star Hobson, the tragic murders of those two young children that obviously have hit the headlines over the last couple of months, I think what Shelley is alluding to is that critical information sharing between partners of building the jigsaw so that we have a true picture as to what that child is living in. So we wouldn't want to reduce that level of information sharing and working together with our partners. Well, not only in light of those tragic murders, but for a long time now, all of the learning from serious case reviews, safeguarding practice reviews alludes to the need for greater information sharing, not less. So totally supportive of what Shelley's saying. It's a good sign. We just need to make sure we're efficient in doing that, in applying those processes.
Yeah, no, I totally agree. No, it's just the number which made me jump a little bit. And yes, as I say, it's a big city, but even so, you don't like to think of any children in this situation, do you? But 60 is a lot of kids. On page 27, and it may be that this is wider than just Sheffield, I think it comes up in a later report as well. That's spiking. And I wonder if you could say something around this, because I'm genuinely puzzled by this. We had a lot of reports in the summer, I suppose it would be, of spiking happening in all over the country, but here in South Yorkshire, spiking of drinks, and then it moved to the possibility of people being injected and spiked in that way. And I don't seem to have heard a great deal about that lately. I know we take it all seriously in South Yorkshire, and you do follow up on everything. And I just wonder if you could bring us up to date really with where we're at in terms of what's happening out there. Do we understand it? Have we got any hard information now?
Shelley, shall I start this
Yeah.
for a false overview, and then you can talk about exactly what's happening in Sheffield, particularly around the partnership, the licensed premises, etc. So we have been for a number of months now monitoring spiking on a daily, weekly, and monthly basis. And what we can see is in the latest month of December, we saw a significant reduction. So it's a 31% reduction in reports in December compared to November. And we know that we had the steep rise in October, continuing into November, and now we're seeing that reduction. It's interesting to note because obviously the ones that have attracted a significant amount of media attention are those involving needle marks, or the victims believing they've been injected with something. Sorry, flicking between screens. So of the 45 crime offences in December, 12 made reference to an injection, of which only one had been confirmed by a medical professional. That's why Shelley will come on next. So Sheffield accounts for 57% of all of the offences and committed in December. And to be fair, I think in previous months, Sheffield was seeing the vast majority of offences relating to this purely because of the size of the nighttime economy in Sheffield compared to the other 3 districts. So Sheffield has seen a 48% reduction, Barnsley seeing a 25% reduction, Rotherham's levels, which have been very low, have remained stable. Doncaster, interestingly, has seen a slight increase from 5 to 11 offences in December compared to November. So quite a significant increase in Doncaster, but they were not representing very many of the offences in the earlier months. Now, I think it's really, again, interesting to note that women do represent the vast majority of victims, but they are not the only victims of this. So 82% of December's crimes had females as victims. However, that leaves us with 18%, and we're regularly seeing reports from men saying the same thing. And that takes me on to my next point, which is very rarely are we seeing an associated offence in addition to the alleged spiking. And so a lot of work has been ongoing nationally around this piece of work. Which we've seen, so they have a silver group. So Jason Harwin, Deputy Chief Constable Jason Harwin, heads this up as the drugs lead for the MPCC. He has instituted a silver group meeting, which has worked with our forensics providers to understand criteria for submission, because we were getting to a point of overwhelming the forensic, the toxicology examinations. So there's been now a well-established process put in place where they review every submission. If it complies with certain criteria, then it is fast-tracked, and we should be getting results back within a month now, which is far better than where we were at the beginning of this. So there's been some real collaborative working nationally and with our forensic providers to improve our response to this, to identify the whatever the substance is, if there is a substance, because we're unclear on that. And as of today, we're still not seeing anything nationally or locally that gives us a clearer indication of what, if anything, is being used, what substance, which makes it very difficult, if I'm honest, to understand motivation, who's involved, to do an intelligence requirement, to try and identify whether this is something on the web that's got some traction or some trending. So it is a difficult position, but thankfully we are seeing a significant reduction. And I know that Shelley has the lead sitting underneath her, so she can talk about all the work we've done around minimum standards to ensure that we're providing victims with a quality service alongside the partnership work to seek to prevent this sort of offending. So over to you, Shelley.
Sorry, just before we go to Shelley, if I understand you right, then this is something that's happening nationally. It's falling away nationally, reporting of this. But you also said that there's no other offence related to it. So people are having drinks spiked or injected and spiked, and nothing follows. Is that
very rarely. On the odd occasion, there may be an additional offence, for example, theft, robbery, or in the worst case scenario, a sexual offence. But we are seeing that they are single figures, 1 to 3%, approximately that level of all of the spiking allegations that we deal with. Very small numbers, and this is a strange phenomenon, frankly, that has evolved since October. where normally we would see spiking associated with a future offence, a further offence, but we are seeing very little of that in the current information picture that we get from victims. So that's why I think I think there potentially is something that's trending somewhere that's caught the attention of individuals. But it is very difficult because needle marks are very difficult to identify. We've all had many injections, haven't we, over the last 12 months with vaccines and boosters. And I had mine last week, and I couldn't see where it had got, where I'd been injected. And so some of the work we did in October, November was to work with the NPCC kind of specialist units under the College of Policing, where we could, okay, well, what injury marks are being left? What's the causation of those marks? What are we seeing nationally? Because if it was a visible mark, it gives me the impression that it's not a straightforward hypodermic needle, which we use for normal injections. Unfortunately, very rarely is there a mark to be identified when the police attend. Sometimes we have medical confirmation, but as I just alluded to in those figures, only one of the 12 had medical confirmation of a needle mark. So it is really difficult to ascertain exactly what's happening here. Now, please do not construe that as we do not believe the victims. We absolutely know that something's happened to these victims, but we're just not entirely sure what. So that is the challenge of this.
And very strange as to what the motivation is. Yeah.
Well, absolutely. So that's why that national group, the Silver Group, the coordination right across the country, not only to fast track the forensic submissions, but also to get a better understanding of what this involves, who are the people involved, what is their motivation, and ultimately to make sure that we're providing those victims with a quality service as best we can based on the information we've got. But as you can imagine, the suspects, it's very difficult to identify suspects in this environment purely because it tends to be in the dense crowds of a pub at 1 a.m., 2 a.m. On a dance floor, which is often where it's taking place, where it's really, you're bumping into people continuously. So it's not like some strangers just walked up to you and you've noticed that. So it's a really difficult challenge for us, but it's one shared with all other forces, and one that we're working with all other forces and the national infrastructure to try and get a solution to. But if that's all right, Commissioner, if that's answered your question, Shelley,
yes,
let's talk about that.
Shelley Sheffield.
So I'll just be brief really, and I suppose it is a testament to the strength of the nighttime economy in Sheffield that we started to identify in the summer that we were having reports and patterns of people coming forward, victims coming forward, saying that they had been spiked, had drink spiked. That was before the needle stick injuries. So we were able in Sheffield quite early on, and before it became probably more nationally recognised, to start our strategy, which is more around gathering evidence to identify the perpetrators, but also around public safety messages, and also what we could do within the nighttime economy to make people feel safe to come out into Sheffield, which of course is what we want for people. We've got a really good meeting group of licensees, and they work well with our city centre team and with our licensing lead in Sheffield, who have been on board from the start around what we can do to prevent and try and detect any offences occurring in Sheffield, because the licensees do not want that to occur within their premises. And especially should that be highlighted, and therefore it would affect their trade in essence. So they are on board with police and partners in trying to deter this crime type. And so from that perspective, they have worked with police and other partners to improve search regimes. They've voluntarily had knife archers outside of their premises. Now, a knife archer is not going to necessarily detect someone with a needle entering a premises, but it might well deter. They might decide not to go there. And the other thing that we've been doing is working with our local corporate communications around appropriate media messages that have been really very important around people looking after themselves, but actually more about focus on perpetrators, because this is about what perpetrators' behaviour is, not about what a victim should or shouldn't be doing as they are enjoying themselves with friends in the nighttime economy. We obviously, because we're seeing these offences occurring first in Sheffield, our neighbourhoods team, together with the investigations teams, have ensured that we've developed an appropriate method of collecting evidence from victims to try and identify the substances being used. They've also got an investigative strategy that they can use in terms of trying to identify perpetrators for the offence that's been shared force-wide. And actually, what was really reassuring is that we've had some of our neighbourhood officers working in plain clothes going into the nighttime economy, speaking to people that are on door staff or people that are working within the licensed premises, asking them what they would do and what they should do if a spiking incident is reported to them. And they are all very on message with the activity that is required based on if they receive a report. And then last but not least, as part of our nighttime economy policing plan, which is quite comprehensive, we also look to have some contingent of plainclothes officers that are working within the nighttime economy, not necessarily going into any of the venues, but that can identify if there looks like any people may be vulnerable to being a victim or may have been attacked because of their behaviour as they're leaving the venues, that are able to wrap around, safeguard them if needs be, ensure they get home safely, but also looking out for any predatory behaviour that other people may be committing. So we're taking this really very seriously. Some of the activities we're doing in Sheffield are now being shared as good practice around the force, and we'll continue to work hard to ensure that the public are safe when they visit the nighttime economy, because predominantly it is something that occurs within the city centre during the nighttime economy, or potentially around student nights, because Wednesday is an important, as you know, student night for Sheffield.
I didn't know until spiking, and then Wednesday suddenly loomed large in everything everybody said. Yeah, okay. Well, it's something we'll follow up in next month's time, I guess, to see how that's developed. Thank you. I'm on page 28 now, under the heading Tackling Crime, Firearms Enabled Crime, and you've written quite a bit there about a fall in discharges from weapons, which is all good, and the targeting of some known offenders in that area. And I just wondered if you could say something around that. It does seem you've had some successes there.
Yeah, I think, to be fair, this has been a really joint effort, Commissioner, with the Specialist Crime Services, the Armed Crime Team that was formed in July last year or the year before now. That ultimately their proficiency, their experience and their ability now to investigate firearms-enabled crime, including all aspects of forensic capture and intelligence, has really led us to be able to do some quite impactful work in Sheffield. And of course, we had the Public Accountability Board, where you saw some of the overt operational activity that occurred on the back of that. Well, from 2 overt phases of activity based on some very detailed work the ACT team have done with the Fortify team, we've seen over 57 arrests for people involved in drug supply. A number of those have been charged, some were remanded, and already we've seen sentencing of 77 years for some of those offenders that were involved in organised criminality and in drug supply on the streets of Sheffield. And of course, what those people involved in that type of activity bring with them: serious violence, knife-enabled crime, firearms-enabled crime. So that, I suppose, speaks to some of the success that we're seeing. And from my perspective, we need to carry that through into this coming year too, because the successes have been excellent, and our Fortify team are looking to build on that work from last year.
Thank you. On page 29, can I ask you about hate crimes? And again, you talk quite a bit about what's happening there, about the potential increase in hate crimes. So could you say something about outcomes? What's happening as a result of all this police activity?
So in terms of outcomes per se, obviously our hate crimes are now all allocated to neighbourhood officers, because we want to build that specialist capability around the management of hate crime. And of course, hate crimes happen in neighbourhoods and in communities, and it's important that they have a handle on the types of hate crime that are occurring. What we have seen since we've moved hate crime into the neighbourhoods, and also actually very early signs, but we've increased our hate crime coordinators by one. Because of the volume in Sheffield, because of proportionality of our size. What we are starting to see is some improvements since then. So in terms of our outcome rates per se, and this for us, when we talk about outcomes, is people that are charged, people that receive a caution, or they might have a community justice resolution. For that group of people over the last 3 months, October to November, we saw a 13.5% positive outcome rate. And actually, when I say it's showing dividends with our hate crime coordinator, for December alone, that was at 20%, nearly 21%, which is good and demonstrates that we're going in the right direction. But of course, there are that we will continue to work hard to actually detect the crime, which is what you're getting from a positive outcome. But actually, some of this is about how our victims feel and whether or not they feel confident to report to us. Hence why there's this really invigorated piece around third-party reporting centres and training for those people within the third-party reporting centres. Plus, like I say, the uplift by one hate crime coordinator is really helping us to feed back to victims and to stay in touch with them and give them confidence to report.
I noticed that, and it does suggest you are taking it seriously, hate crime. On page 30, this is under the heading of organised crime, and I'm looking at page 30, and also on page 33, I think it was, there's a reference to juveniles. And I wonder if you could, probably around county lines, I don't know. I wonder if you could say something around this, because I suppose the anxiety is that the age of people getting caught up in organised criminality seems to be going down, and therefore the risk of having people who are both victims as well as offenders grows. And I wonder if you could just talk around that a little bit.
So I think on page 33 there, we're talking about neighbourhood crime and a group that have been mapped around particularly burglary. That is a mapped organised crime group that we have identified through better knowledge, investigation and intelligence around our burglary profiles. What we can say from that organised group is that probably just about half of the people that are mapped within that group are under the age of 18, and so not massively under the age of 18, but still would be classified as children. So what that does do is that does give us some challenges around the management of those young people to try and turn them away from crime and to manage any offending behaviour. And we do that work not only through the detection of the burglaries, but also by working with our with social care and with our safer neighbourhood services around the management of those young people with youth services to try and rehabilitate them, if you like. In terms of organised crime on page 30 that you've asked, yes, young people do get drawn into organised crime, and that might be involved in county lines through drug supply and drug dealing. Now, where a person is under the age of 18, they will still be, if they are arrested for possession with intent to supply drugs or any of those types of offences, they will be dealt with as a suspect. But equally, we will also look to see whether or not that young person is being exploited, how they've been drawn into that exploitation, and look to gain intelligence and do an evidence-led prosecution where that is appropriate, to look at the source of that exploitation. So yes, we do have some younger people drawn into organised crime. We will still deal with them as suspects, but also where they are young people, then we have access to, for example, the multi-agency child exploitation group, the Amber service, which is multi-agency service looking at exploitation within Sheffield. So we have a duty to look at them as a victim as well, but we will still investigate any substantive offences that they've been involved with.
Okay, thank you. On page 34, you reference the Youth Independent Advisory Group. I think people in my office will be very glad to be kept in touch with that, Shelley, and perhaps be helpful around that in whatever way you thought appropriate there. And then on to page 35, this is stop and search. I'm just a little bit concerned about that, because you say the team have made, this is the third paragraph down from the top of the page. The team have made 33 arrests, conducted 61 stop and searches, resulting in an 18% positive outcomes.
Yeah.
Made me jump a little bit, because we've normally said if you start to fall below 20%, and I think if Anne McCaskill's on the call, she may want to say something. If you start to fall below 20% positive outcomes, you may start to get in trouble with your communities who need to be supportive of stop and search.
So that is just in relation to one neighbourhood team. So I think you need to look at that in the context of the overall stop and search data. To be fair, Commissioner, I haven't got the data on hand, but Sheffield is consistently over 20%. That is in relation to, if you remember, we made a decision to put an additional sergeant into the South East neighbourhood team, because we had one neighbourhood-led team that covered both the Manor and the Arbourthorne estates, and we decided to make two teams out of that. Because certainly our residents and our commitment to neighbourhood policing in there. So ultimately, what you're seeing there is the results of one team that are newly formed, just to demonstrate that they are undertaking quite a bit of activity within their neighbourhood based on what the residents are telling them that they're concerned about. So yes, that 18% positive outcomes is still, or almost 1 in 5 of the stop search results in the officers finding something, and I'd be comfortable with that just around that smaller team. But like I say, if you took the data across the city in total, we would definitely be reaching 20% and higher.
No, I hear that. Just something to watch. I think that's all, probably. I don't think there's anything else I wanted to say on the report, Shelley, unless there's something you wanted to draw attention to.
No, all I would say, Commissioner, is I'm still very proud to be leading Sheffield, and as it says right at the outset of the report, what I've commented on here mostly is those matters that you would want to find assurance of. Our officers and staff within Sheffield are really dedicated, working hard day in, day out, and not more so actually than recently, because the Chief has mentioned that the Omicron variant is having an impact. But what we're finding is that our officers in Sheffield are still very resilient, still doing everything they can to avoid infection and managing daily business as normal. So just really pleased that they are still managing that delivery in what is pretty difficult times for other public services.
Thank you. No, I do agree with that, and thank you, and thank your various teams for what they do. That's great stuff. Thank you very much, Shani.
Thank
So
you.
shall we move on in the agenda then to item 11, which is forced performance against the police and crime plan. Tackling crime and antisocial behaviour is the kind of big headline, and it's item 11. And Dan, I think you're going to probably respond to this. Again, if we can just take you to one or two things, and if there are things that you want to come back to, then please do. So I'm looking first of all on page 40, under the heading Investigation Workforce Plans. And this is around the major incident. Well, if we say something first of all about the uplift and the welfare management of officers, I wonder if you say a little bit around that, who are exposed daily to traumatic events, those particular officers who are exposed in a particular way, and especially at this time when we're all fragile anyway. Could you say something around that?
Yeah, certainly. So first of all, it's important to recognise that the major crime team do exactly what it says on the tin. So they're investigating, for example, a number of murders that are ongoing. Now, talking about the reference in the uplift, the uplift of 4 sergeants within that department has greatly assisted them to achieve their 3 monthly welfare meeting that they have with all their members of staff. And that's really important and really key because, although that's a 3-month sort of check that and a discussion that they have with their line managers, which is really fundamentally important for all the reasons that we recognise. It doesn't mean that we stick to that. So if it's apparent that officers are exposed to significant or prolonged trauma, maybe a particularly graphic incident that they may be involved in, then the line managers will bring that forward and speak to the officers. And officers are also supported by the trauma risk management sort of model that we use called TRIM. And that's basically sort of signpost people to additional support. Now, we also have the yearly psychological health screening that officers in a number of departments, including the major crime team, that takes place. So that's an annual thing. But we're currently recruiting another 3 specialist roles within occupational health. So I'm hoping they're going to be in place within probably the next 8 to 10 weeks, subject to all the checks that need to be done in relation to those. But that will feed in nicely to a quarterly meeting that I chair, where I'm looking at not only staff and police officer assaults, but also the psychological impact and trauma of our officers. So again, once those individuals are in place within the occupational health unit, what I want to do is, once they're in place, is to examine more closely around the psychological trauma across the force, and actually, is that annual screening, number one, is it covering the right units and departments that we currently offer that to? Do we need to widen that to other departments? So it's a process that is continually under review, and it's something that I pick up every quarter.
Okay. Is there much literature around this as to things like how long can people be doing this job before you really need to move them out? Or I just don't know enough about it.
Yeah, I mean, we don't have a particular timescale where individuals will, for example, you can only be on this team for a particular amount of time. However, having said that, something that we are examining through consultation with the National Police Wellbeing Service, which is called Oscar Kilo, we're sort of looking at pause points. So if we are hearing a particular member of staff or an officer is struggling, then we will, what we're keen to do is to put in place a pause point, or if they want an attachment outside of that unit to give them a bit of a reprieve, then we are fully supportive of that. And that is something that you know, those 3 monthly welfare meetings are really key, because they are designed to sort of spot those risks and sort of intervene before, you know, an officer becomes particularly affected and then goes sick with stress and all the stuff that falls out from that, which is what we always try and avoid for obvious reasons.
Okay, thank
The
you.
Commissioner, the one area where they do, there is some guidance is PVP, and particularly focused around indecent images of children. So their recommendations is between 3 and 5 years. And so we put in place a rotation policy, which is exactly what Dan's just talked about there, a pause point. So for staff that are approaching that period of time in PVP, to rotate them out of PVP, even if it's only for 6 months, 12 months before, if they want to go back, they can go back in, because obviously a lot of our staff are dedicated to that piece of work and that portfolio. So it is about making sure, but that is the one area where there is some national guidance, but not in relation to many others. And as Dan articulates, you know, trauma affects all police officers in different ways. And they're exposed to different levels of trauma dependent on their role. So it's important we learn from that.
Yeah. Yes, many years ago, I spent half a day, or not even half a day, I think, with that particular unit, and it was just horrendous. I mean, just after a very short period of time, you really just wanted to go out and bang your head against a wall or something. So yes, I do understand. Okay, thank you. On page 41, Dan, this is 3.12. This new unit, Investigations Improvement Unit, which seems really good, raising the quality of investigations. Again, I wonder if you could just say a little bit around that.
Yeah, I don't know whether Sarah, you want to chip in, because I know Sarah meets regularly with the team that are behind this, but obviously we want to improve the investigation quality across the force, and we are taking the sort of learning. There's a number of forces that are currently under inspection from our colleagues in HMIC, and we're taking the learning from that and trying to implement various things that are being led by the Investigations Improvement Unit. But ultimately, it's to make sure that the victims, for example, are receiving a really good quality service. That we are taking all the steps that we would be required to take around the investigation, making sure that victims are kept in contact, that we agree a contact schedule, that all the steps that we take through any investigation leads to a satisfactory outcome for the victim. And also taking into account the risk aspect of crimes as well. So it's a unit that's particularly focused on doing that and liaising and providing guidance to officers across the force to make sure that those standards are adhered to. But I suppose, Sarah, do you have a bit more detail that you'd be able to give?
Yes, it's to gain traction on investigative standards. It's to enable us to just use very few members of staff, because it is a very small team, to actually understand the themes. So instead of doing audits and then just looking at individual results of audits, it's about collation of the audits. So to identify the themes so that we can use our limited resources most effectively and most intelligently to tackle those areas where they are commonly appearing in those audits. So and they're there to not just provide the feedback, they're there to actually come up with some of the solutions to staff and be a central repository, linking in with other forces that have very similar setups, so that we're all learning and driving forward for exactly the reasons Dan's said, which is providing bringing the offenders to justice, and 2, providing victims with a quality service. So yeah, it's been set up really came into fruition in October, so still relatively new, but introducing some new qualitative assessments rather than a focus on binary quantitative ones, which will hopefully help us to make that progress that we need to around investigative standards for the sake of victims.
Okay, thank you very much. Can I move to page 44? And this is 3.36. You talk about force analysts identifying 16 communities where there had been real issues around burglary offending. and as a result of their analytical work, you were able to reduce, to have some focus on that and to reduce burglary by 26%, which is really very good indeed. And I think it's just very helpful to me to see these sort of statistics, because one of the things I get a lot of pushback from the public, particularly at this time of the year, is that the force should be spending more money on the usual story, Bobby's on the beat, not on things like this. In fact, sometimes I get analysts actually referenced. We don't want analysts, we want police people in uniform who are out on the street. But this is a very good example of how the analysts have reduced the burglaries down their street. I wonder if you could just say a brief word around that. But then at the bottom in 3.38, you mentioned doing further work around domestic abuse. If you could say something around when that might be forthcoming, the timetable for that.
Yeah, certainly, Commissioner. So first of all, problem solving delivery. I mean, yeah, that's very much informed by analytical work. And I suppose what's really important and key is that we put the officers where there is most need. And we have, for example, around between 220 on average to 250 sort of POP plans, problem solving plans that are active across the force at any one time. It normally is around that figure, and they can cater between focus on areas such as burglary reduction in areas that we're seeing particularly increasing demand around that, or any sort of crime type really. But it also deals with people that have particularly complex needs that cause demand not only on our service but our colleagues in the NHS and the local authority, for example, that warrants a multi-agency response. So having a POP plan and the sort of analytical detail really helps us to get to the grips with what the causation factor is. So we're not just continually responding and seeing demand keep increasing. So we really want to get to the root cause. And the only way we get to that root cause is doing that analytical work. Or it's certainly a big contributing factor. It's not needed in every single, problem-solving plan that we have, but it does form a fundamentally important aspect to a number of them. So yeah, that's of paramount importance. So it's just to provide some reassurance that that figure of around 220 to 250 varies. That'd be different next week because they're continually being opened and closed down once problems do get resolved. And what we really want to do is avoid things being entrenched and sort of very long term. In relation to your other point around the response to domestic abuse, now I'm conscious that it's referenced the work that we did apply for a grant from what we call the N8 funding, which is effectively 8 universities that support 8 police forces in this region. Now we weren't fortunate enough to be successful in that bid. However, what we are doing is working closely with Essex Police, West Yorkshire, and I know that Wales have the same sort of format in place where we're learning about their domestic abuse problem solving team, as they've called it, and we're looking at how that model can be incorporated into South Yorkshire. And effectively, this is looking at enhancing existing suspect sort of processes that we have, that we've previously referenced and discussed in PAB, like the MATAC process, and looking at how we can provide additional support for offenders who are unable, we're unable to always put them through the criminal justice system process. So it's very much to promote coordinated activity with various agencies. For example, if you've got a perpetrator that is particularly vulnerable through drugs or alcohol, that we do all we can to try and prevent the continual cycle of offending. But the DA problem solving team that we're learning from those other force areas are also focused on protecting the victims as well. So Detective Superintendent Dave Cowley is sort of progressing that work. So although the Sheffield Hallam work that is referenced within the report has not been successful, doesn't mean that we stop there. So we're continually looking at our colleagues and other forces about what they're doing.
And David Cowley, that's the VRU David Cowley, is it?
It is, yeah.
So we can learn from that. Lovely, thank you. On page 46, 3.50, you're talking about modern slavery, human trafficking, etc. And clearly you need the public to give you intelligence information around this if you're going to make, you know, serious inroads into that. I just wondered if you could say something about how the public can do that when they're scared stiff of saying anything to the police. How do they do it?
Well, I suppose number one, it's really important to stress the importance of intelligence that comes from the public, which in turn turns our activities into crime prevention, to detecting crime, to reducing crime. So it really assists us, and it's of paramount importance that it really assists us to focus our resources and respond to the changing needs of communities. So without that intelligence stream coming in, that will really, you know, prevent us doing a number of those activities. I mean, members of the public, my advice to members of the public would be you can contact us via our online reporting services, via officers and staff within our neighbourhood teams that are there to provide reassurance and that close contact with local communities. Alternatively, they can contact 101 or even, you know, Crime Stoppers, the free phone anonymous number of 0800 555 111. God, you testing me there, making sure I get the treble fives and the treble ones around the right way. But there are a number of avenues by which members of the community can contact us without necessarily giving their personal details, which again is really important. And just to touch on Crime Stoppers a little bit, we get an awful lot of really good intelligence from our local communities through that means. That we do. I mean, every bit of intelligence that comes through our systems, we assess, we cross-reference it, we see if we can take action on it, we develop it. So the intelligence that comes from our communities and the public is of paramount importance to us.
Okay, so Crime Stoppers is a good route.
Absolutely, yeah.
Okay, thank you. Page 47, these are neighbourhood crimes. Neighbourhood crime and ASB is the heading. And I'm looking at the list. This is something to keep you awake at night, if I may, Dan. And this is underneath your little chart there. You've got in 3.53, despite the positive steps being taken in reducing volumes of neighbourhood crime, the force acknowledges the continued challenge as rates of neighbourhood crime exceed those being experienced in peer forces. I wonder if you could say something around, do we understand that at all? Why should South Yorkshire be an outlier in this respect?
Yeah, I mean, it's number one, it's something that was already sort of referenced around. We analyse an awful lot of data around some of the crimes that are listed there around residential burglary, trying to spot where areas which are particularly experiencing sort of increasing levels. And like I've referenced already around the pot plans, we try and put things in place to reduce or give us our best opportunity to try and reduce, working with the public and partners alike. I suppose, I mean, I haven't got the list of forces that have a similar demographic to us that are categorised as our most similar group of forces, but we are very different to that group, and we do have challenges around a number of vehicle types, a number of crime types, of which one of those, for example, is the theft of motor vehicle, which has seen nearly a 20% increase. And this is in relation to the type of technology that offenders are using to steal vehicles around interfering with the signal that a key would provide, enable them to take the car. And we are seeing an increase, although other areas that are neighbouring South Yorkshire also experiencing that increase too. So, I mean, comparing ourselves to other forces is always, there's always a bit of a caveat to have with that, in that our demographic is a bit different, as all areas are.
I just wondered what way we're different, if that's the factor, if that's the key factor. But I mean, it may be that we simply don't know, in which case, fine, we don't know, but other than to note that we are different. But
yeah, I mean, I suppose the only other the other reassuring element to it is if we do, because it's not just South Yorkshire offenders that offend in South Yorkshire, and we, I mean, Shelley's alluded to it before in the Sheffield report around county lines in previous PAB reports. When we do identify offenders from other areas, we do work really closely with those force areas to not only I'm trying to understand, you know, the level of offending in our force area, but also, you know, taking positive action against them with the sort of owning force. So yeah, it's a challenging one because the demographics of South Yorkshire, like I say, all the areas are different. Yeah, it's a bit of a challenging one to sort of articulate, really. I suppose any further.
That's your homework for next time. Okay, thank you. I just maybe have one more thing. Just let me have a quick look. Did I have something else? No, I think that's probably it, Dan, unless there's something you wanted to point up to.
I just think there's a lot of momentum and questions being asked, certainly in the communities where I go and visit districts around e-scooters, which is something I think you've raised before. And I just wanted to use this as an opportunity just to clarify where we stand with e-scooters, because I think there is a bit of confusion.
They mustn't do it, but do add to that, yes.
No, I mean, e-scooters, you can only ride them legally on private land, effectively. That's the message that we need to get across, where people have the landowner's permission. I mean, I know there's a trial that's currently being led by the government, and the details of that are on the government website. But at the moment, the same legislation applies to sort of a motorised vehicle. So the tricky thing with e-scooters and people thinking that they're lawfully able to use them is that, you know, you might be looking at things like no insurance. Using that on a public highway can have some quite big implications. So yeah, I just wanted to clarify that it's not currently possible to get, for example, appropriate insurance for privately owned e-scooters. So that results in them being illegal to use them on in public spaces. So I just thought it'd be worth clarifying that part, because I know it's something that's gaining momentum. It's something that we're teasing out through conversations with local communities, because people are buying them online and they're whizzing around all over the place. And no doubt we're going to start to be picking up the odd occasion where criminals will be purchasing these to affect their escape, no doubt.
Yeah, what one member of the public said to me was they went to an area of the country where they are being trialled. They didn't know that could happen. And of course, they saw these people on e-scooters and thought, well, should I report them or stop them, or what should I do? But of course, it was an area where there was trials going on. But, yeah. Thank you. Oh, Linda, I saw you suddenly pop up on screen. Was that because you had a question or a comment? Or no?
Oh, I'm just here ready for a later item, Commissioner.
Oh, okay, thanks. Thank you very much, Dan. That was item 11. We're on to Chief Executive reporting, item 12, strategic planning budget setting update. Now, Sophie is not well. Michelle, is this yourself?
Yeah, Commissioner, I can cover it very briefly. It's a verbal report, just giving you an update on the strategic planning process. There's a dual track, as I've reported before. The setting of priorities in your new police and crime plan. We're nearly there in the iteration, which has gone through consultation and had inputs from various parties, including the force. So you and I are agreeing the final draft this week. The second track is, of course, the budget setting for next year, 22-23. We've had clarification of government funding shortly before Christmas. You are now having a look at the budget requirements from the Chief Constable, the office, our office that is, and commissioned services. And the finance teams are looking at various budget assumptions that we need to make, the reserves position, etc., so that you can then have a recommendation to you around what the precept proposal needs to be, which will then go through various consultation with South Yorkshire leaders and ultimately to the Police and Crime Panel, who has a statutory role in relation to receiving that proposal. So that work is ongoing between the two finance teams at the moment. The precept proposal as well comes on the back of consultation with the public, again, a statutory requirement for you to consult with South Yorkshire communities. And that consultation has been going on throughout the year in some guise or other, but more formally and more recently, specifically around figures for the precept. And that precept consultation closes this Friday, so it's too early to report how that is shaping up. So that's where we are, Commissioner. The leaders' papers will go out today, and then The Police and Crime Panel meeting is at the beginning of February. So by the time we come back to PAB, we will know how all of that has been finalised.
Lovely. Thank you very much. Comments, questions? Okay, thank you. Then item 13, race disproportionality in the criminal justice system. This is a paper produced by Linda. Linda, do you want to say a brief word about your brief paper?
Yeah, my brief paper. The essence of the paper is just setting out there that the commitment in the Police and Crime Plan this year was to hold a roundtable event with criminal justice partners just to focus on race disproportionality in the criminal justice system. Because of the way that things were occurring generally in community at the time because of COVID, then the decision was taken to hold the event virtually rather than in person. The event took place at the beginning of October, the 5th of October, and we had a number of presentations from the various criminal justice partners on what they understood around race disproportionality from their individual perspectives. The details of the objectives of the event are set out in the paper, which was to identify where disproportionality is known to exist or not, as the case may be, to identify where we've got gaps in knowledge and understanding, to decide how further work should be taken forward to address any issues that have been identified. And as I say, partners were invited to let us know where they stood. A task and finish group was established as a result of that roundtable, and they have met on a couple of occasions now. They will be reporting to the next Criminal Justice Board, because Criminal Justice Board has not met since that roundtable event. That'll be in just over a week's time on the 18th of January, where we'll be considering what happens next, in essence. The task and finish group, as I say, they've been looking at what has emerged. So it's been looking with some areas of particular focus around victims and witnesses, around suspects, defendants, offenders and prisoners. We've been looking, a couple of themes that emerged was we've been looking also of what internal work within our internal organisations either has been occurring or could occur. And also looking at some external focused activity. So looking at, well, how do we build those links? Who is already doing that? Are there opportunities to work together and identify some good practice? And work that I'm currently being involved in is actually looking at other criminal justice boards. What have they been doing as well? Because actually that might be quite useful, because one of the key things that we need to be mindful of is that for a number of the criminal justice partners, they're not South Yorkshire configured, they're actually national organisations. And so for a number of the partners, their activity and focus in this area is really being driven at a national level. So, so we need to be mindful of that as well. So obviously we'll be in a position to report after the next Criminal Justice Board meeting, when we'll have a better understanding of what's going to happen next.
Thank you. And I take it that what you found in 4.1 second lot of bullet points and the last bullet point, there is no consistency in the way in which race disproportionality is being assessed or considered by partners. If that's true here, that'll be true across the piece, will it, when you're comparing one local criminal justice system with another? And
yeah, I mean, because what we found was that actually where do you base your comparator from what you're seeing and experiencing in your part of the criminal justice system? What are you using as your basis of, well, what is the ethnicity of that particular area, configuration, geographical spread? So certainly one of the things that the Task and Finish group is considering is whether or not we just try to look at creating some consistency for ourselves, if indeed we are going to look to progress that work. So, for example, we're looking at whether or not might we just all reach an agreement to rely on the census data, which we appreciate there are some that it's older data, but it does mean that there is some comparator that we could all latch onto and be able to do that. But as I say, it does present its challenges, because not all of the criminal justice agencies are locally driven and locally determined. Some of it's based at national level. So
Yeah.
have some challenges.
So there's new census data, of course, rolling off the press, ink not yet dry, even as we speak, isn't it? So
yeah, and that's one of the reasons why we might, for example, be suggesting that we do look at the census data, albeit that it's only repeated every 10 years. As you say, the latest census data isn't available yet, but it might be something that would emerge over the course of the next 12 months or so.
thank you. Questions or comments, anyone? Right, thank you very much, Linda. Thank you for that. That was 14 PCC decisions. Michelle, tell me what I've been doing.
Commissioner, it's worth probably just highlighting some of these. So the first set of decisions, 4.2.1, relate to the fact that you have a community grant scheme made up of funding that the police confiscate or forfeit off criminals, in essence, through the criminal and the civil routes, respectively, and you put to good causes. So there's a table of organisations that you're funding through the community grant scheme there. 4.2.2, that is you accepting funding through a grant to undertake evaluation in relation to trauma-informed services in South Yorkshire, so that we understand where any gaps or duplication arises to improve services there. Local Resilience Forum has received money nationally at 4.2.3, so you formally approved that. We've had some personal computer for SYP uplift, which you've approved, 622,800 there at 4.2.4, and then we've had some extension of recommissioned services through your office. The most recent one is in relation to the ISVA service, the independent sexual violence advocates. So those are the decisions, unless there's any questions. They're published on the website in any event. Thanks,
Okay.
Commissioner.
We probably ought to explain what Reds in the Community are on our website, just in case one of our local MPs gets a bit excited about that. Okay. Thank you very much. I think that's everything on that. So shall we move then to item 15, which is yourself again, Michelle? Work.
Yeah, we send the work programme out in advance. Just to note that the third of your 3 focus areas from the current police and crime plan is there for a thematic, which is the road safety roundtable, which Fiona is leading from your office with partners. So there'll be a verbal report or a written report next time in relation to that, the last of the 3 focus areas. And then we'll move into the new police and crime plan after it's published, Commissioner.
Thank you. Questions or comments? Right, assurance panel reporting. Steve, you've got a JIAC assurance report, 67 to 74. It's quite full. Don't know if there's anything you wanted to pluck out from that.
Thanks, Alan. I just wanted to pick out 1 or 2 things. The committee wanted me to talk about the Child Matters training that Dan Thorpe told us about. It's been developed by SYP and the NSPCC, and all frontline staff are going to receive that training. We often pick these things up that are currently in the news, and the obvious link there was the Arthur Lavinia Hughes tragedy. But we thought it was very important that the public know that SYP officers are being trained in Child Matters. The other 2 or 3 big things: the work being done to improve the information services governance, especially with the shared service with Humber. We're going to continue to monitor that until we're able to give complete assurance to the Chief Constable and PCC that everything is as smooth as we would like it to be. We're also concerned that the internal audit findings were not being acted on quickly enough, but we're assured that this is in the main because staff had been over-ambitious in setting the target dates, and that's going to be resolved, and more realistic dates will be set in the future. And then finally, external audit work is still to be completed, but it will be done this month, we were told. The draft opinion from Grant Thornton is unqualified, but the value for money work will be completed this month, which meets the required timetable and will be reported to JIAC in March. That's all I've got, Commissioner, unless any questions on the paper itself. On
page 73, this is Treasury Management mid-year report. Yeah. The very last sentence, as at the end of September, investment stood at 41 million. the average return on investment being 0.15%. That's not much better than I can do in my savings account. I mean, this is just the way of the world, is it, at the moment?
Well, it is the way of the world. Sophie would have been able to explain that in some more detail. But obviously that's changing at the moment, isn't it? Because interest rates are rising. Yeah, it's the way that it's been for the last 10 years, I think, isn't it?
Mm. Okay, thank you very much. Any other questions or comments? Right, thank you, Steve.
Thanks.
Shall we go to item 17 then, which is the IEP assurance report, and there is a report, pages 75 to 80 in the name of Anne, but I didn't see Anne on the list of attendants. No. Michelle.
No, Commissioner Anne has had to send late apologies, so okay. I can't really cover it in detail, although I'll go to the meetings. Anne is far better able to cover the items. But each of the sections are set out there in accordance with work led by a thematic lead that we've got from the panel members, and work has progressed well. We now have new templates to allow focused discussion at each of the panel meetings so that we get the full value of the panel's views on ethical issues that are coming up, and the new horizon scanning item at the end, which is the end of the report, is on every panel meeting where we look ahead at the horizon coming up so that we can future spot items that might present ethical issues for South Yorkshire Police, and we can have an initial discussion and commission work there. All of the areas covered are either where you are asking for assurance on your behalf because of your statutory responsibilities, or you have commissioned the panel to have a look at some topical issues, especially around disproportionality. So unless there's any questions, Anna's set out there the very full report of the work that's been undertaken, and I know we also make the police and crime panel aware of the work because of their interest as well.
Yeah. I think the last thing that you mentioned on the report, the importance of horizon scanning, I think that is very important. I think that is what an IEP really ought to be doing to help the force. On page 77, this is 3.5, retention of BAME officers. I think we've had a focus on recruitment. I'm glad to see we've also got concern now about an equal concern for retention. I don't know whether you wanted to comment, Lauren, no particular reason why you should, but I'm glad they got that in their sights as well.
It is something that's being tracked through our people board. We're looking at the recruitment, retention, promotion, progression, etc. of our minority staff from across a range of characteristics.
Yeah, thank you.
Just to add there, Commissioner, as well, I know DCC Forborough has been doing some work to look at exit interviews as well, so we can see what we can glean from those people that are leaving. So,
yeah. I presume an exit interview is a voluntary thing. You can't force people to say anything when they're on their way out. But what kind of percentage do take part in that, Lauren? Do you know that? Or?
I don't know, Commissioner, off the top of my head, the percentage of people that take part in it. I offer an exit interview to people that are retiring on completion of full service, both officers and police staff. The take up from that is around, I suspect, around 50%. Some people want to come and talk to you about their experiences, good and bad, some don't. I suspect that where people are leaving and they're feeling disgruntled with the organisation, or perhaps it's not the career that they perhaps thought it was going to be, they're perhaps less likely to want to engage in an exit interview. But it's something that I shall ask the question of our pod.
Okay. Is this, it's a semi-formal thing, is it, or is it tea and cakes, Lauren?
When they come and see me after 30 years service, it's generally tea and a biscuit. But an exit interview, otherwise it's quite a formal process. There's a questionnaire that's gone through with members of staff that are leaving.
So after 30 years, it's tea and a biscuit?
And a certificate.
Oh, and oh, that's all right. Okay. Right, thank you very much. Thank you for that. I think that brings us to any other business. I think that has to be notified. There wasn't any notifications, so there can't be any. So thank you very much, everyone. Our next meeting is on 7th of February at 2 o'clock. I look forward to seeing you then. Thank you.
Thank you.
Bye-bye.